Let us explore the arcane world of standards. We call it arcane because when you begin examining where standards come from and how they are created, it can seem quite mysterious and obscure. However, as is often the case, the practitioners of standards use a lot of highly specialized terminology to describe what is in reality a fairly straightforward process. When you complete this course, you will have been introduced to some of the terminology that practitioners use and will have been introduced to some of the basic process steps that most standards follow, from initial concept to published document. In this course, we will explore 3 questions. First, what is a standard? And more particularly, what is a consensus standard? We will then look at the process for creating standards. In this session, we will focus primarily on standards developed by 2 international organizations that do a good deal of work in the medical device area. They are the International Organization of Standardization, or ISO, and the International Electrotechnical Commission, or IEC. There will be more to say about these organizations later in the session. Finally, we will spend some time exploring why you should care about standards and the standardization process. Before we begin, we need to understand a couple basic terms. The first term is standardization. Simply put, standardization is the use of common products, processes, procedures, and policies to facilitate attainment of an objective. The objective can be to improve safety, reduce cost, increase efficiency, gain access to markets, and ultimately to be more competitive in the global marketplace. Standardization is an engine that helps make the global marketplace work, and work efficiently. Across all industry sectors, there are literally hundreds of thousands of standards in use every day. The second term is conformity assessment. Conformity assessment is defined as any activity concerned with determining directly or indirectly that relevant requirements are fulfilled. While a standard is a technical expression of how to make a product safe, efficient, and compatible with others, a standard alone cannot guarantee performance. Conformity assessment increases the confidence that personnel, products, systems, processes, or services have been fairly evaluated against the requirements of a standard. Through testing, inspection, and auditing of products and management systems, conformity assessment is as important as the standards in ensuring that products and systems are safe and perform as expected. In many industry sectors, particularly where safety is involved, conformity assessment is carried out by a third party, usually called a conformity assessment body. Conformity assessment bodies are frequently certified by some national certification organizations as being competent to carry out their assessment activities. In the medical device sector, that certification organization is usually the government ministry responsible for health and welfare. Examples are the notified bodies in Europe, who are identified and certified by the competent health authorities in each of the member states. With that background, let us begin with the first of our 3 questions. What is a standard?